Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Podcast, a podcast exploring all aspects of children's palliative care around the world. Sunflower Podcast is bringing curiosity, humor, and reflection to the world of palliative care. We're exploring the joys and challenges of working in this incredible field, including topics related to education, advocacy, self-care, service provision, and leadership from around the world. My name is Rachel Neufeld, and I'm thrilled to be here as a guest host for this podcast. I'm a pediatric palliative care nurse practitioner in Vancouver, Canada, working for Connect Place Children's Hospice. Anu is a palliative care nurse with a special focus on community-based and pediatric palliative care. For over a decade, her journey has taken her from bedside nursing in rural India to leading home care teams, facilitating training programs, and advocating for compassionate, accessible care across borders. She is a volunteer with organizations like Soul Palliative Care, Palliative India, and Two Worlds Cancer Collaboration. She is deeply passionate about strengthening nursing leadership, especially in low-resource settings. She believes every child, every family, and every community deserves dignity in life and in death, and that nurses are key to making that possible. Through writing, teaching, and connecting with peers around the world, she hopes to amplify the voices of nurses and help shape a future where equity and care is not just a vision, but a reality. Hi, Anu, and thank you so much for taking a few minutes out of your busy schedule to have a chat with me today.
Thank you for having me here, Rachel. Thank you.
So I would love to hear in your words, tell me a little bit about this recent echo that you did specifically for nurses in palliative care. Tell me a little bit about this program that you created.
First of all, thanks to TWCC for giving me this golden opportunity to co-lead this brilliant program. The recent introductory course in pediatric palliative care nursing, hosted as an ECHO program in October 2025, was an incredible learning experience. We had over 140 nurses from 30 countries coming together to learn, grow, and share. We explored the core aspects of pediatric palliative care nursing through 8 sessions over 8 weeks. What made it truly meaningful was that it was entirely nurse led, facilitated, and supported by nurses and our program manager. Every session, case, and breakout room was nurse led. The most remarkable aspect is that 100 nurses completed the course and received a certificate despite the sessions being held outside the working hours. These nurses participated from homes, hospital wards, and during their transit, not out of obligation, but out of genuine passion. Their commitment was truly humbling. This wasn't just a training, it became a global circle of compassion with vibrant energy and active participation.
That sounds absolutely incredible. I am blown away that you had over 100 nurses participate, and the fact that you could organize a training program of that size, I find absolutely incredible. Can you tell me a little bit about what drew your interest to do this? What stimulated your desire to create this program?
Well, it's little personal for me. Although I was a palliative care volunteer nurse for several years, from 2004, maybe I first learned about pediatric palliative care only in 2013, after almost a decade, during a visit to a hospice in Chennai, South India. Although I was always wished to support children who are deteriorating after cardiac surgeries in the place I worked, I was not well aware about something like pediatric palliative care as such. Later in 2014, I started searching for training in pediatric palliative care, and to my luck, I found a training at Tata Memorial Hospital in Mumbai. But this made me to realize how important training is, especially for nurses, and also helped me to understand the challenges nurses face in getting trained. Since then, I have tried my best to train nurses in pediatric palliative care and to create awareness, but nothing great has happened. Far too often, nurses are left out in this space, especially in low and middle income countries. That hurts. That is hard to watch. So when this opportunity was shared with me by Dr. Spandana of Sunflower Children's Network to co-lead an echo alongside champions like Dr. Megan, Tara, Rizwana, and with global partners like GPN and ICPCN, I said yes with all my heart. Pediatric palliative care is not an easy path. As nurses, we are often at the bedside, the ones family cry with, the ones children cling to, the ones who are asked the hardest questions. But many of us are not trained in the way that we need to. And there is a huge gap. And in that gap, there is a moral distress, there is burnout, there is silence. So I found this opportunity as a way to give back. And as a volunteer with Two World Cancer Collaboration and as a member of GPNN, this felt like a natural step, an extension of our shared mission to empower nurses in every setting.
That is one of the more inspiring intentions and reasons to do this kind of training. And I really admire the approach and the fact that you've recognized that nurses, particularly low and middle income countries, really don't get the spotlight in terms of the kind of work they do, nor the kind of training they receive. And so your passion to try and advance the nursing care as well as the training that they get, I think is really quite inspiring. Can you tell us a little bit about some of the successes that you saw during this course or some of the wins you think you've made?
There were so many wins, many. But one that stays with me is that the courage shown in the Zoom chat box. We saw participants who were initially shy started speaking up, asking brave questions, and even sharing their stories of caring for children in refugee camps, slums, or remote hospitals. The chat box was active and it was so enriching. And coming to the scores, some scored 25 out of 25, yes, full marks. But beyond that, they grow in confidence. One nurse messaged me and said, I no longer feel alone. To me, that is a biggest win. We built not just knowledge but a connection, and it's spreading. Also, many nurses shared that they were participating in this course, such a similar course for the first time, where they are encouraged to share their stories. Nurses who had never spoken publicly before and thought they had nothing to offer began asking questions, offering insights, and saying things like, now I know I can do this better for my patients. Others reached out afterwards, after the course, asking how they could start local programs in in their own language. This gives me goosebumps. And I must highlight this. These nurses from rural hospitals, urban slums, refugee camps, and war-torn regions showed up consistently, scored highly, and stayed late. Almost for all the sessions, we had crossed 100 participants, almost always. I think that's a great win, a success to be shared.
Yeah, I agree. And I think that those of us in Western trained programs, we see nurses at the bedside. We see them as the frontline workers that they are. And I think the fact that you have highlighted the immense work and capacity that these nurses have in other places that are under-resourced or underprivileged and under-respected. I think the fact that you've been able to empower and inspire and also teach like how to provide this really good care sounds pretty priceless to me. I'm curious as you kind of look back and you think about having taught this course, organized it, the responses that you got, maybe some of the feedback, like all this wonderful improvement. Is there anything that you would have done differently or maybe where there might be rubs or places that it didn't go as well as you thought? Or what kind of things might you do differently next time or try to improve on?
Yeah, initially, we found that some nurses had difficulty to start, get registered in ECHO and to, start the training through ECHO. So we're planning to have an orientation session for nurses who are unfamiliar with Zoom or Echo so that they can become a little more familiar to facilitate that initial easy launching. We are also planning to conduct sessions in the regional levels when they request to build a community. Also, we wanted to add some follow up surveys, offer some mentoring plans or practice sessions in the future sessions so that we can build a community. We don't want to just leave them after the course ends. So this can continue and slowly we can build a community. Also, this course taught us that it is scalable. Here we have another plan. If the nurses in the other countries who want to adopt this program in their local context, we'll be there to support them. We'll share content, offer mentorship, and empower them to lead.
I'm really happy to hear that there's been an awareness of not just doing the training and letting them go, because then how do we know that there is improvement in the work being done, or how do we know that there is use of the knowledge gained? And so I'm really glad to hear that there are plans for mentorships and follow-ups and things like that. But it also leads me to my next question, which is what you hope to see in the future in the world of nursing in pediatric palliative care. Like what should we be aiming for? What do you think is next for these nurses?
Every nurse believes that every child deserves compassionate, timely, and dignified care, no matter where they are or what kind of disease they have. So, when we invest in our nurses, our patients benefit. Palliative care, especially for children, can be lonely, more so in countries with limited infrastructure or no formal training and heavy clinical burdens. Nurses are really stretched thin, and when they are unsupported, the emotional toll is immense. That's why we need communities. We need spaces that are safe, sustaining, and nurse led. The eco model is an extension of that, kind of a digital circle of learning that grows across time zones and borders. There are a lot of dreams around this program to run multiple echo in different time zones, to offer basic foundation training while connecting nurses to ongoing learning and leadership pathways, raise a global awareness around pediatric palliative care, and advocate for system level changes, amplify nursing voices in publications, policies, and platforms. Nurses are not just caregivers. We are advocates, we are teachers, we are also leaders. And of course, research. We need to collect more data from nurses, our contributions in journals, policies, and global tables. So the dreams go on. So, what's next? For me, it's building a sustainable communities of practice. We aim to roll out a pediatric palliative care fellowship in 2027. We dream of a world where every nurse is trained, trusted, and empowered to support seriously ill children and their families, where pediatric palliative care is embedded in nursing curriculum, where government consider our values. So there are a lot of dreams. I hope through in the coming years we'll be able to have give a structure and then lay foundation to make things happen.
You have such bold dreams, and I love it. I love that there are hopes and dreams for immediate future of how do we scale up a little bit to local regions. Maybe there are scalable courses in local languages and, like you said, local time zones and things like that. And then you have such grand goals, and I am so hopeful to hear your goals of improving and increasing nurses in research and leadership and what this could mean to the nursing profession. I think through witnessing what you have accomplished in creating this one echo course and having over 100 nurses hear about pediatric palliative care and how they can learn about it, improve their care, improve the suffering of children worldwide. I think you're unstoppable. And I think that there are going to be so many more things for you to expand on. And I only see brightness in your future. And I'm so excited to see where you go with this. I wonder, Anu, if you have, candidly, do you have anything come to mind that surprised you about doing this? Things you weren't expecting?
There are some invitations we received some requests we received to support a local level pediatric palliative care training, especially in Sri Lanka.
Oh,
And
okay.
also, there are nurses from EMR region. They came and said they want to do it in very regional specific, context specific, because in EMR we have different social issues going on, and pediatric palliative care is very emerging here, which was so surprising because it requires a lot of planning to do this. But then nurses coming up boldly and opening up and requesting that they offered all the support that they said they will lead it, they will arrange all the local resources. They
Mm-hmm.
just want our experience and competencies. So that was surprising. And the other part is the faculty pool that we created. It's such an amazing faculty pool. And this would have never been a success without those faculties that we had. And to every nurse who joined us, who gave time, shared their stories and the trust, that was amazing.
I hear you coming back to the growth of community and that, nurses aren't alone in the work that they're doing and the support that you guys received from each other, which I think is underlooked quite a bit. I'm curious how things are in your world now in terms of the work that you're doing. Has anything shifted for you in your practice or in your job, your facility? Is there anything new because of doing this course?
Course, the network that we created, especially from South India and all, we are planning to build up a community so that we can have a referral system, a support system for children who are needing in palliative care, which was something that we were actually waiting for years together. So now we know who all are there, got our training, whom we can call for support, whom we can ask for a local networking. That's something great. And we also plan to have some kind of continuity programs in the local setup where I work back in India.
I absolutely appreciate the benefit of a network. It's something that I've learned to appreciate in my work too is are there people I can call and just say, "Hey, what would you do in this situation?" Or, "Hey, can you help because you're in that community and my patient or the family is going to go to that community." Having those people that you can call on. And then, of course, I love that you have created this network globally. So, you mentioned this group of faculty too, and all the nurses that want to build and expand on nursing in pediatric palliative care. I think we're all behind you and want to support the ongoing expansion of this work. And we want to support each other because there's a lot of nurses in a lot of different places around the world that are trying to make this work a little bit better, make the care of children a little bit better. So I think it's pretty astounding that you have created such a massive network in such a short period of time. So I want to thank you so much for the work that you did, for doing this coursework, for being so passionate about nursing in pediatric palliative care. It's a breath of fresh air to hear just how passionate you are about nursing and how important it is. So I'm really excited to see where this all goes. Is there anything in particular? I know you're coming to Hyderabad for the upcoming conference and things that Two Worlds is going to be around and participating in as well. Anything that you're particularly looking forward to?
First of all, I want to thank for giving me this opportunity to all the faculty supporters, Dr. Megan, Tara, Dr. Spandana, Rizwana, you, my dear Rachel, Kamara, and full faculties from ICPC and especially Dr. Julia. This became successful because of all the well established and deeply experienced faculty members who graciously accepted the invitation and sharing their generosity. See, the sessions were not just teaching sessions. It was a kind of, inspiring sessions for the nurses to take up. Thinking about Hyderabad, I just want to meet everybody and to plan more things so that I am very confident now because of all the global team that we have to support this program. So to plan more, get recharged so that we will grow as a community. One nurse, one child, one conversations at a time.
Oh, Anu, you're such an inspiration. And This comment made me think of some of our early conversations with Dr. Spandana as well, of how to start this echo program and how do we
Yeah.
aim it at the right people, and the worry of what nurses were going to think if we gave them this information that maybe they thought didn't belong to them, or no, that's for the doctor to do. And to hear your confidence having grown so much for you to have this confidence to just take on the world and build this and expand this just makes me so incredibly happy. It is such a pleasure to talk with you. I'm really sad I'm going to miss you in Hyderabad, but I know that there's going to be a ton of awesome people getting together and you guys are going to have the best time. And I'm sure that it will be inspiring and to each other. And I can only imagine the conversations that you guys are going to have and the ideas and all of the amazing things that you're going to work towards. So I look forward to stories of how this goes for you in Hyderabad, and I look forward to some of the newer programs and the things that are going to come from it.
Thank you, Rachel. Thank you so much. Actually, you have helped me to be steady. Thank you for helping me so much. I always look forward to meeting you.
Thanks again, Anu. I'm sure there'll be more conversations in the future. Thank you for listening to this episode of the Sunflower Palliative Care Podcast. These podcasts grew from a seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related issues. To learn more or to donate, please visit twoworldscancer.ca.